living longer, living healthier, living better than ever before. Welcome to Mountain Pacific's Healthy Living for Life, a weekly series that gives you the information, education, and expert insight you need to become an active participant in today's ever-changing healthcare climate. Here now is today's program host.
The first half of 2020 has been marked heavily by the effects of COVID-19, as positive tests across the U.S. are now in the millions. What have we learned about the virus, and what is the second half of 2020 going to look like? Welcome to Healthy Living for Life, a show dedicated to helping you do just that. I'm Sarah Medley, your host. Stay tuned. Welcome back to Healthy Living for Life. Joining me this morning is State Medical Officer Dr. Greg Holzman. Dr. Holzman, thank you so much for joining us this morning.
Thank you.
One thing we know about COVID-19 is the information that we're receiving is consistently and constantly changing. So what we knew yesterday is going to change tomorrow. And we're recording this episode 2 weeks before it will actually air. So it will change in a couple of weeks. But as you and I are now Zooming, and we're recording this, we're not face to face, what do we know today about the virus?
Yeah, I'm glad you put in that caveat because it is changing so quickly. And some of the things that we've talked about, as the science comes a little bit clearer, we've made changes and recommendations. We've also heard very quickly about the newest and greatest things, and some of those things have fallen to the wayside during the process. Some of the things that issues that we have learned have been, we're familiar with coronavirus, which is this type of virus. This is a unique and novel one, and it is new to us. When it really started, a lot of people thought it was in December. It might now be an earlier time. And in some ways, this virus is acting like coronavirus, and in some ways, it's not. Some things that coronavirus sometimes does is it tends to go a little bit down in the summer months. We're not really seeing that as much as we were hoping to. Also, when the virus is most likely to spread, we're still learning more about. So there's been a lot of concern about, we know there are people that are asymptomatic, don't have symptoms, or many people that are pre-symptomatic, that they might test positive before they show symptoms. And we don't have a great understanding yet about how infectious they are at that time, but from contact tracing and stuff like that, we do look up to 2 days before people start to have symptoms because we're concerned about those things. So having some better understanding of the virus helps us think about ways that we can try and prevent it. So the issues of a mask, which has changed over time, is also a concept that we're really trying to talk about because people can have the virus and yet not know it yet. So by putting on a mask, trying to protect others, if you actually have the disease, and there's even some questions about, even with a cloth mask, does it have effects back to protecting you? Still learning some more on that. Hand washing, the points of continuously doing disinfectants of areas of high-touched places. And two things that I think that we're really trying to get used to in our new normal is the social distancing and aspects of thinking about that within every interaction that you're having. And the other thing, which is sometimes counter-American in some of the ways that we, gung-ho working, is stay home when you're sick. And that is so, so important at this point in time, that if you're feeling bad in any way, please stay home. Don't go and visit your elderly parents. These are not things to do at this time.
When this all started, there were a lot of concerns about testing, and there were very few people getting tested. Are we still concerned about the number of folks that are getting tested?
In Montana, I hear the comments across the country. In Montana, we're doing extremely well, and it's not a shortage of testing at all. There is a little bit of education that I think is starting to hit everybody, but it's like living through the Great Depression. After the Depression happens, everybody's wondering about should they be spending, when's the next Great Depression going to be happening? And I see that a little bit with people worried about, don't use the test, we got to save it for a later time. But we have more than enough tests here in the state right now. We're getting out and doing a lot of asymptomatic screening around the state in many different ways, trying to hit high-risk populations and areas where we might see want to catch the disease as quickly as we can. So Montana being a big tourist state, we're doing a lot of work around high tourist areas right now, and aspects of like that congregate living, those areas. So we have more than enough tests. If you have any symptoms and feel you need to be tested, you should be able to get that test.
If we don't have symptoms and we just want to be tested, I've heard others talk about that. Oh gosh, there's free testing going on. I think I'll go get tested. That really isn't that great of an idea, or is it?
Well, it's helpful in the public health sense. In the individual sense, it might not be as valuable in the sense that it doesn't give you a ticket out to say, hey, I don't have the disease, I'm safe, I can go do what I want to do, because it's just a moment in time. And it's just saying, hey, you don't have the virus right this moment, but you could pick it up right afterwards. You could have it a day later. However, from a public health standpoint or surveillance standpoint, by doing mass screenings or doing screenings in areas of high risk, we're more likely to hopefully find something early. And finding the disease early allows us to do the contact tracing and get ahead of an outbreak. So we want to keep any outbreaks that happen small and try to prevent these large outbreaks.
In the minute that we have left, some states did not issue stay-at-home orders. Do we have evidence that staying at home, wearing masks, physical distancing is really working to flatten that curve?
I think there'll be tons of stuff written on this afterwards. I can tell you from what we've done, I think the governor did exactly the right thing by suppressing the virus early, getting us to think about the new normal, and then opening up slowly to keep the virus down as much as possible. And now we're going to have to sadly learn how to live with the virus in the community.
Thank you so much, and you stay tuned, because when we come back, we're going to debunk some of the myths of the coronavirus. Welcome back. I'm talking with State Medical Officer Dr. Greg Holzman, and now we're going to be talking about the impact of COVID-19 on mental health. Thanks again for being with us. We appreciate it, Dr. Holzman.
Thank you.
Social distancing and social isolation is going on right now for most people. Talk to us about what that's doing for folks that are dealing with mental health issues.
Yeah, I think all of us are struggling with this. And I think one of the ways you use those two words, social distancing does not mean social isolation. And so we do need the human connection. I think we're all learning how to use computers a little bit better and being able to interact and have conversations on that way. In fact, it has allowed me to do some reuniting with some old high school friends through Zoom and stuff of that sort, as they've been social isolating at home or social distancing at home. So we started some of those things up. But that is so important. And we know, along with the issues of just the virus, there's a lot of other things going on in this country right now that is causing stress and anxiety for a lot of folks. And we need to have open conversations and discussions. So you shouldn't feel isolated, and use different measures. There is crisis line numbers if you need that, if it's at that point in time, and crisis in all different levels, because people might not be considering it mental health, but many people are struggling right now financially with everything that's happened in the economy and thinking about how they're going to do things or how their business is going to run and stuff like that. And so sometimes to have that connection and talk to other folks that might be able to help you through those problems, whether that be financially, how you're going to do things, is so important at this point in time.
With summer now underway, help us understand how we can enjoy summer but yet be mindful of physical distancing. What can we do?
Well, I think that's, the summer months are absolutely great for getting out and being about. And that's something that we can enjoy with family and friends at a social distance. I love to hike, and Montana has some incredible places to go. Go out fishing, go and do different things with the same friends that you might have done that before. But keep the social distancing concepts in mind. The other thing is, when we talk about grouping, the concept is trying not to group with too many different people. So you might choose a small group of friends that you hang out with more and do more with, knowing that everybody's kind of staying in that same group. That also decreases the chance of exposure. And, my mom, who's is in a high-risk group because of her age, felt very isolated for a while, and then she decided that two other of her friends, that they were family and they were just going to do some things together. But it was just those three, and that's how they were going to move forward. And I think some people have to be creative in that and balance the aspects of risk and benefit and risk to others.
There have been some speculation, at least I've heard, that warm temperatures and the like might positively impact the spread of the COVID virus, and maybe that's hopeful thinking. Talk to us about that.
Yeah, that's kind of from the beginning when we were talking about the coronavirus in general, and there's other coronaviruses that are out there, but that family tends to go down a little bit more in the more humid months. And also you have in the summer months, people tend to be a little bit more social distance because we get to go out and we're not in close proximity and everything. And that might be the case. We still might be seeing some of that. Who knows what would have been going on right now in the summer months. But the virus, the bottom line is it wants another warm body to be in. And so if it can find another warm body to go into and it can make that jump from one person to another, it's going to do it. If it can't make that jump, excellently, it dies. The virus dies, from if it can't make it to the next person.
We've heard a lot also about folks that are at higher risk for the complications of COVID-19. And a lot of our viewers fall into that category. As we open up, and we're now maybe more engaged because businesses are opening, what can those folks do to protect themselves?
Well, I think there's a couple different things. There's a lot of personal things that they can do by protecting themselves, and that is by social distancing and really considering where and when they're going to different places and what kind of risks they'll be in contact with or close to anybody who might be carrying the virus. And they've got to kind of consider that anybody around them could be carrying the virus. So, I would be careful about going into facilities that other people aren't wearing masks, if that's what you need to do to go to a grocery store or something of that aspect. The other things that you can do is really remind other people around you how important it is that they stay safe. It's not that you're healthy when you're visiting grandma and you're just wearing the mask and making sure things are good, but you're doing, going to all sorts of other events that you're putting yourself at a lot of risk, because then you can become the vector that gets the person who might not could have a much worse outcome at risk. And there's new data coming out about young people, and we'll start to learn more about how they might present with symptoms. So the younger folks need to be protective of everybody around them too. We're all in this together.
I think that's a really important point. We are all in this together. So we're going to take another break, and when we come back, we're going to talk more about COVID-19. Stay with us. Welcome back. We are joined by State Medical Officer Dr. Greg Holzman, and now we're going to try and predict the future. We'll talk about treatment for COVID-19 and the vaccine. So Dr. Holzman, again, thank you for staying with us. Yeah. Let's talk about the vaccine first. So we are all hopeful that there will be one. So put some reality on the time frame and the process of getting a vaccine.
Sure. So my crystal ball is about as good as everybody else's on the vaccine aspect. I think we all are very excited about an opportunity for a vaccine because I think people feel like that's the return to normal. We've seen vaccines come by very quickly and in different things, and other things we're still trying to find the vaccine, like HIV, and that started in the 80s, early 80s. So I don't know exactly where we're going to be on this. They're going through trials. Some of the trials have been up further along, lots because of another coronavirus, which was SARS, if you might remember, and MERS. There was vaccine development started in that time and then slowed down. Now with this virus, that helped them get a little bit ahead of the game to start putting things together to try to develop a vaccine for this virus currently. I've heard all the same comments that everybody else has as far as, something by the end of the year and something not until 2021. And to be honest with you, I don't think anybody really has a good idea at this point in time.
In the absence of a vaccine, then let's talk about the treatment for COVID-19. So if I were to test positive for the virus, how would I be treated?
Sure. Well, let me take one step back first, because our best treatment in this is still prevention. Prevention is the treatment. And so we've talked a lot about the things that people can do. But the other thing to think about, we know that people that have underlying health conditions are at much greater risk. So having those underlying health conditions managed at the best possible way is another way to, be better prepared if by chance you were to get this virus. So if you have diabetes, is it under control? These type of things to think about. But for those who get the virus, many people do fine, and they will just stay home and prevent it from spreading to other folks within their household, and definitely stay isolated at home and prevent people from outside of the house from passing it on. Then you would treat it just like you would treat many other things, rest, fluids, those type of aspects. Tylenol, Motrin, those things if okay for you to keep the fever down. If people get sick enough and they end up in the hospital, it's still mostly supportive care at this point in time, that they're going to try to help support you through your body fighting off the virus itself. There are some treatments that are out there, some that are being tried, some that are under emergency use authority, like remdesivir, which is an antiviral medication that has gotten it's not FDA approved, but it's approved for providers in an emergency use authorization, and has been used here in Montana for some patients. The data on that, and as far as the long term, does it change things? We're still learning on. The early studies thought that it decreased the amount of time that you'd be in the hospital, but there's still more to find out. Did it even decrease morbidity and mortality, which hopefully we will learn and continue to go on. And as you talked about at the beginning, this is being taped 2 weeks in advance. Yesterday in the newspaper came out all over the place about a study out of the UK on using low-dose dexamethasone, which is a steroid that we have, cheap medication that's around, that decreased the risk of death in their studies. It's come out on the paper. It's, from what I hear, a good research group and a lot of individuals, so it'll be very interesting to read. To the best of my knowledge, it's not out in print yet or in a peer-reviewed journal, so I haven't seen the data specifically on it, but it's always encouraging to see those aspects. And I think we learn more each and every day. So hopefully, first and foremost, again, prevention is treatment. So let's do that as much as we can. But for those that fall through the cracks and do end up getting the disease, continue to learn and do more to be able to help and treat those people.
I am obviously interested in reading the news, as a lot of folks are these days, and now we're seeing increased number of cases across Montana, and so there's concern that, why is that? Talk to us about what we could expect, given the fact that Montana is a tourist destination and we know people will be coming into our state. Should we expect to see more positive cases?
I think there's a good chance we will. And I do want to clarify one thing that I think people think a lot about the tourists that are coming in, and there is risk. They're coming from all over the place, but there's also a lot of risk of Montanans who go visit other places and come back. One of the differences that tends to happen, and this is just a generalization, but tourists that come here to go to Glacier National Park or something like that tend to stay in their own group. They're a family unit. They go to their restaurants together. They go to the hotel. They go hiking together. Montanans who go elsewhere and might pick up the virus and come back, they go back to their normal regular activities. They're going to go to church. They're going to go to summer camps and all those other things. And then you have a much more higher risk of passing it along to other folks. So those are some of the concepts to be thinking about. And I think our best tool right now is what people are doing for prevention and us being able to find people with disease early and make sure that any outbreak stays to a small outbreak. So far, we are seeing increased numbers in Montana. The good thing is many of them are clusters, and we're being able to get around those clusters to try to prevent it from going further. But all you do need is a few embers to get out there, and it can get a lot worse. So we got to keep on our toes. And as we said in the last segment, we're all in this together.
Yeah, and we cannot emphasize that enough, that we need to protect each other by doing exactly what you've been talking about, which is prevention, prevention, prevention. So again, Dr. Greg Holzman, thank you so much for being with us. This is Healthy Living for Life. Join us next time.
Healthy Living for Life is brought to you by Mountain Pacific Quality Health. We'd love to hear from you. If you have suggestions for future programs, visit our website at mpqhf.org or call us at 406-443-4020. You can also catch us on YouTube by visiting our website and clicking on the YouTube icon. Production facilities provided by Video Express Productions.